can see the V. Yeah.
Yeah.
No button, sorry.
Okay, so this is hip joint examination assessment. We'll start off with our active movements. As in the other videos, don't forget you would always be doing a bilateral comparison, so uninjured side and then injured side, comparing those two against one another. So we're just going to go through each of the movements actively first of all. So the first one is flexion. So we can only take them from this neutral position into flexion. It's active, so they're doing it. So what I'd like you to do is I'd like you to bend your knee, bring the heel along the bed towards you, and then pull your knee into your chest, just using your leg. Don't use your arms to pull it in towards you. As far as you can go. And then coming back down. That's extension back into neutral. Next thing is going to be abduction and adduction. So what I'd like you to do is just with this leg, just like you to take your leg slightly further out towards the edge of the bed. That's it, perfect. And now this one goes out to meet it. Okay, now what I'd like to do is take your leg, you're going to bring it all the way out as far as you can this way. It's really important that your foot, your toes, are facing up towards the ceiling. Okay, that's it. So just keep those toes facing upwards and don't let them turn out. Keep coming as far as you can, and then back to meet the other side. Okay, and obviously we then move these legs to this side to then do the other side. Next up is going to be medial lateral rotations. We move those back to the middle. Okay, so what I like you to do is just to pull your knee up until it meets my hand. That's it, excellent. So we like 90 degrees and 90 degrees at the knee and at the hip. I want you to imagine that there's a rod going through your thigh bone, and my finger is pointing to that rod. And what I'm going to get you to do is you're going to move your foot inwards and outwards, and you mustn't move your knee away from my finger, so you can't do that. Okay, so just keep that in line there. So you first of all take your foot inwards for me. Bearing in mind this is lateral rotation because it's rotation of the femur. Then take your foot outwards for me and all the way back in for me. That's it, try and keep that nice and stable. Good. Back to neutral and back down. Okay, and again we would try the other side. The last one is going to be the end of range extension, which we'll just do now where we're going to turn Neil over. So I'm just going to show you that one now. In the protocol, what I would expect you to do is just to visit that one at the very end, because if you keep turning someone over, then you're actually going to be irritating potentially their injured joint, which is the hip. Okay, so we're going to do that one now just to show you. So Neil, if you just turn over onto your front for me. Okay, so remember, once they've turned over, they are now on the opposite side. So if I was to do the same leg, that would be this side. So what I'd like you to do, Neil, is first of all, I just need to get to your lower back. So is it okay if I just roll your t-shirt up slightly and just roll your shorts down slightly, so just so I can place my hand on your lower back here and stabilise it.
Yeah, no problem.
So we come up and we come down slightly. So I place my hand just here on the sacrum. Now what I'm going to do is I'm not going to apply too much pressure. I just want to feel really if you start to pull your pelvis backwards. Okay. So just with my hand on there, I can then feel for any movements in the pelvis, so I know at what point we really limit the amount of range in the leg. Just like to raise your leg up off the bed then, keeping your knee nice and straight, as far up as you can possibly go. Okay, and that's it there. Now if they were to do it false, what would happen would be they would typically do this. They start to twist. Okay, so with your hand there, you can feel the movements that is happening at the pelvis to know whether they're doing it wrong or not. Thank you, take it back down. And turn over onto your backing up for me. So next up is passive. So just move ever so slightly towards this side of the bed, thank you, making it slightly easier for me. So we're going to go into passive flexion of the hip. So we're going to hold underneath the knee and onto the ankle, just so we've got maximum support. They need to be relaxed, so therefore we need to be taking good control of their leg. It's no good kind of just trying to point with little fingers, because they're going to contract and stop you, and they should be completely passive. So you want nice, decent support. So we start to bring that up there, move our hand back on top so that we're not going to get in the way with our hand underneath. Hand comes on top there. We start to bring it up and keeping an eye on this leg here. So as we start to come up, the pelvis can start to rotate, and we want that flat down there. And then I'm going to use my shoulder and chest to pull that in. I need to keep an eye on his face to make sure to see if it hurts at all, as well as also looking back at that leg. So if I just show you here, you can see that leg just starts to rise, so we're getting to the end of range. Okay, so we apply our pressure and our overpressure, seeing how it feels, and then we're going to come back. Okay, abduction, adduction. So passively we can't add any overpressure into adduction, only abduction. So we need to take them from this adducted position here, and remember we need to control the positioning of this foot. We don't want that foot rolling out again. To achieve that, the hand comes in from the outside underneath and round the underside of the knee. With the pelvis, we also want to stabilise and make sure that they're not rolling their pelvis over this way. So to do that, you need your hand on the ASIS. So Neil, are you happy with me just rolling the shorts down slightly, just so I can get to the very front of your hip here?
Yeah.
Okay, so there we are, there on the front, and this hand's going to come underneath and round. So I'm supporting in my forearm and elbow, holding onto the knee so that I can try to keep that leg in the right position for what I want to achieve and stop it from rolling out towards me. So here and here, just nice and relaxed for me, and I'm going to take your leg out. So keep an eye on that foot, seeing his reaction, and there we have our overpressure. Okay, bring it back in. Medial lateral rotation. So we're going to pull up 90 and 90 again. Two different positions for this, two handling positions. One, we can just support at the knee and holding at the heel. And what we can do is we can take the foot round here into medial rotation. And then as we come back in, coming into lateral rotation. Some of the slight issues with this could be just stressing the knee joint a little bit, especially if they've got a sensitive knee, or if there's any laxity in there. So an alternative method, rest it on your forearm, supporting around the knee, and you try to apply a lot of the pressure here, and only some of the pressure here. So again, we can come round, and then all the way in. Depending upon how much range they have would depend upon which side I would stay to. If this leg started coming around here, if I saw that in the active, then I would actually do it from that side. Okay? So then we come all the way around to here, and don't forget to then come back to end of range there. So it's end of range at the two extremes. Okay, so moving on now to our muscle test. Rectus femoris, we'll just go through that one again. So Neil, if you just like to come towards the edge of the bed here. With that arm, just hold on to the edge of the bed just so they feel stable. I'm here to make them feel like they're not going to fall off the edge. I'm going to work on this leg here. So what I'm going to ask you to do is just to take that leg off the edge of the bed. We're going to be working the muscle on the front of the thigh here. So what I'd like you to do is to raise your knee up into my hand until you feel my hand. That's it. So coming into flexion. This hand's going to come down towards the end of the ankle. And if you just straighten your knee until you feel my hand, that's it. Just pause it there. I'm going to push down here and down here, and you're going to keep it here, keep it in that position. Okay, and just start to resist for me. And resist, 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 and relax. Okay, move yourself back in. Next up is sartorius. This is our long talus muscle from the outside, from the ASIS, all the way across to the pes anserinus on the medial and posterior edge of the tibia. So right the way across, the longest muscle we've got. So therefore it's going to flex and rotate and abduct. So we've got to try and do all three of those things to muscle test it. Okay, so Neil, what we're going to do is we're going to bring your knee into this position here. I'm going to have my hand on the inside. Remember, don't grip them. So you're going to have your hand here for adding your rotation. And this side is going to come up on top. Positioning of the elbow is important, as Neil highlighted. So just raise your leg up for me. So we're going to push, you're going to pull your leg up into my hand. Then I'm going to add on that you have to push your knee out towards my hand. And then I'm also going to push here, and you've got to try and turn your foot inwards. Okay, so start to bring up and out and rotate. So keep that there, keep it there, keep it there, and relax. Next up is iliopsoas, so our strong hip flexor. So therefore we're going to bring it into hip flexion. So you just like to raise your leg up into this position here. You're going to go to the head end. Sorry if I fall a little bit out of shot, but your hand is going to go onto their shoulder, and a nice straight locked arm against the knee here, whilst they try and pull their knee up towards them. Okay, so we're just going to stabilise and arm up here, and if you just raise your knee up into my hand, that's it, and then just keep going, go on, keep going, keep going, keep going, and just start to relax. Okay, next is our abductors. So 4 different positions here to differentiate. So we're going to first of all start off with flexed position, feet together, so we've got consistency, and it's a slightly better positioning in terms of offering the resistance. Hand clenched fist, and the epicondyles are going to drop into these parts of your fist. Don't have your hand too high, because what can happen is they push, then your hand pops out. So you need to make sure you're nice and deep buried in there. So what I'd like you to do, Neil, is just start to squeeze up against my hand, and you'll feel if your hand is in the wrong position, because you already feel it starts to try and jump out. Make sure you clench your fist. If you don't clench, they'll crush your hand. Okay, and then just pull your knees together. Well, keep pulling, and relax. Okay, so this is more into the muscle belly. Then what we're going to do is we're going to take it a little bit wider. Elbow just below the medial epicondyle, hand and palm again, same thing, just below the epicondyle. You can just use your other hand just to make sure you're nice and steady with them. And again, just start to squeeze and squeeze, keep going, and relax. Okay, now next thing, we're just going to go nice and straight. And again, we're going to use fist. Again, fist in between the knees, in between the epicondyles, like I do now. So now we're coming further up towards the origin of the adductors. What I can do is squeeze your knees together in this position. You should feel that acting a little bit higher up. And relax. And the same thing now, just coming down the distal end between the malleoli. And again, if you just like to try and squeeze your feet together this time. Squeeze, 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 and relax. Okay. So a few more muscles to go. So we've got gluteus medius and minimus. So we're going to turn them onto their side. If you turn them face that way for me. Make sure their head is nice and supported. We're then looking for a nice straight line. Just put your head up. Looking for a nice straight line from their head and neck all the way down through into their pelvis there. So you don't want them rolled, you don't want them flexing or extending. So nice and straight and nice and square, not twisted. Next thing, they need a nice base of support, which is their underneath leg. Tends to be people put it a little bit too far forward, and then they tend to start to roll. So just think a little bit more about bringing that slightly backwards. Okay. And for glute med and min, in terms of differentiating it from TFL, what we're going to do is with our TFL, just lift your leg up and straighten it out. So we want a nice straight line all the way up here, so just backwards slightly. That's it. And you're going to need to stabilise on their pelvis. You have me just placing my hand on the very top of your hip here, this portion. So nice and stable. So you can then control them, they're backwards and forwards. Make sure they're nice and stable. And just keep your leg in that position. So this would be our TFL as an abductor, but we want glute med and min back here. So to take out TFL, what we're going to do is bend the knee. Naturally what happens is this, the leg starts to come forward. Okay, so we just need to keep that slightly further back, stabilising here, and then on the knee I'm going to push down against your leg. I like to pull your leg up into my hand. Just raise it up slightly. That's it, and then keep it there, keep going, and relax. Okay, so TFL is the next one, so just to repeat that, leg straight, so again, nice straight line here, same thing, supporting the pelvis, just below the knee this time. Again, keep them nice and square, and just raise your leg up into my hand. That's it, and then keep it there, keep going, and relax. Just watch out for them twisting their leg this way. They start to try and use their iliopsoas as a hip flexor to trick the movement. Okay, last two is the hamstrings and the glute max. If we lay you on your front for me. So for hamstrings, different to the knee now because we're interested in how it works across the hip. So therefore what we're going to be doing is trying to activate the hamstrings partly as a knee flexor and then engaging that across the hip. So the way we do that, you just slightly unlock the knee, so it's just slightly flexed. We then ask that you also raise your leg up slightly, so it's coming towards extension. We need to stabilise back here again, making sure that you're getting your consent and you're placing your hand on here, and then you're going to come just below the knee to apply your pressure. Don't go too close, just lower third, or you can come slightly further down. Just watch out for gastroc engagement. I'm going to push down. I want you to try and raise your leg up into my hand. Okay, and just resist. Keep it there. Keep it there. Keep it there. And relax. Okay, it's a nice activation there of the hamstrings. Last one is our glute max. Same type of thing, but now what we do is we flex the knee to try and take out the hamstrings. And now they're so short, they can't really help with the extension movement. So then we get more activation of glute max. So then just raise your leg slightly off the bed. Hand just up in here, and again, stabilising on the back. And we're now going to make sure you use your body weight over the top. Okay, and then just pull your leg up into my hand and resist, 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 and relax. Okay, use your body to help you rather than I could have pushed this way, but this is making it a lot harder work for me. Okay, last section is now our palpation. So then if you roll onto your back again for me. So we're going to work on iliac crests first of all. So trying to go through this in a slightly more logical process. So again, we need to expose, and nearly happen me just pulling up your t-shirt and lowering down your shorts slightly so I can get to the very top of your pelvis here, the top of your hips.
Yeah.
So we just raise up and then pull slightly down because we need to get to the very front, this portion here, and then the actual ilium and the iliac crest is in here. Now to find the iliac crest, we're going to come into this part here, which is nice soft. We've got ribs, we've got the pelvis. We're going to come into that softer part in the middle there, and we should feel that it's nice and soft and squidgy. If we then come down, we then come to bone. At that point there, we've met the bone. That is the pelvis, and that is therefore the iliac crests. Okay, so we can come from the iliac crests towards the rear. Don't come right underneath. Don't start trying to give them a hug. Just come from this slightly posterior lateral portion, and we'll deal with the rest of it when we turn him over later. And then from here, you can either do it bilaterally if you're able to make an appropriate comparison, or keep one hand still and feel one side iliac crest and work your way around slowly and methodically. If we keep coming round and round, round, and then eventually you come to the front point where you've then got this nice sticking out portion at the front. So that is iliac crest round to the ASIS, the anterior superior iliac spine. We can do the same thing on this side, following round, 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 until we come to it. And do that way. Don't just, I've seen it 1,000 times where people go, ASIS, that's there. If you make that assumption and don't go through the process, for one, you'll lose marks, and two, you are assuming that they're in the same position. They could have a tilted pelvis or a twisted pelvis, and it could shock you when you go, oh, you've only got one. So go through the process to find both of them, and then you're actually feeling them and also looking to see if in this position they seem equal, as well as having looked at it in your observation when they're in standing. Okay. Okay, next up is the pubis symphysis. So Neil, I need your help on this part. What I'd like you to do is with your hand from your belly button, I'd like you to walk your way down, sort of through past your navel, and until you come to a bony part, which is essentially at the very front of your pelvis. That part there is known as your pubic bone. So you could work your way down over the top of your shorts till you come to what feels like a hard bone part of your pelvis. Once they reach that part, you need to feel over the top of their hands. Make it clear that that is what you're going to do and why you need to do it. So Neil, if you just keep your fingers there, I need to now feel on top of your hands to ensure whether you feel any pain experienced at all. There are the two bones converge together like this, so I'm going to essentially feel that side and that side, and then in between the two is a joint. I'll then also feel in that joint for any pain. Okay, are you happy with me proceeding?
Yeah.
Okay, so then on top here, what I can then do is I can feel over to one side where we've got the right hand side tubercle, over to left side towards the left tubercle, and then in between the two where there is then the joint line. Okay, obviously asking for pain throughout. Okay, okay, so if you just, we're going to next move on to where the ASIS and the pubic symphysis join together, which is then our inguinal line. So again, if you could just walk your hand down just to that same point for me, please, and just keep your hand there. I'm then just going to feel again to find this point at the very front of your pelvis, just on this one side. Okay, so there is our ASIS, and the inguinal ligament, and therefore the line, is from the ASIS to the symphysis pubis. Now we can feel, especially if we come at least halfway down that line between those two, we are feeling along the ligament and feeling for any issues or pains that they may have. Once we get halfway, that should be the joint line. To also check that, what we need to do is find the greater trochanter, find the very top of it, and see if that's bisecting at the same point. Okay, so Neil, to find the next part, what I need to do is roll your shorts up, and I shall work up the outside of your leg to this bony point at the very top of your thigh.
Yeah.
Happy with me doing that?
No problem.
Roll the shorts up. So we're going to work up the outside, so I'm just working up the outside here until we come to the bony landmark there. So it's nice and clear on Neil. On some people you may find it difficult palpating with your fingers, in which case use the palm of your hand and get a little bit firmer in terms of being able to push this way. So if you push there, and you can see the force that I'm putting in, then you'll feel the bone a lot clearer. That then gives you an indication that that is where it is. So then I can double check again with my fingers, go yeah, definitely on it. Find the very top as well as the very bottom and the front and the back. So you're going top, bottom, front, back. If we then recheck the top, that is that line there. Again, if you could just run your fingers down onto your pubic bone, and we have our ASIS. Draw a straight line from here and across, and that's almost exactly halfway. Come to that same point, so in theory that is our joint line for the acetabulo-femoral joint. And now I want to check whether I'm in that location and feel it while we move the joint around. So if we raise the leg up, come onto the top of the knee, just gives us a little bit more in terms of control without having to kind of grip hold of their leg this way. So on top of the knee, and then I can just move their hip around in small circles. I can feel there, I'm definitely at the joint line. Okay. Okay, so the last two is the PSIS and the ischial tuberosity. To find that, they need to be on their front, and we can also finish off the last part of the iliac crest to find the PSIS. So if you could turn over onto your front, please. So again, Neil, I need to just raise your t-shirt up so I can get to the lower part of your back, into the top of your pelvis. And I may need to roll your shorts down slightly just to get to that. Are you happy with that?
That's fine.
Here, the shorts are pretty much in the right position already. So again, same thing. Come into this soft part, come down. There we have the ilium. So I'm going to do it, I'll do it bilaterally this time, so both at the same time. It's a skill to learn to do that, but it can make your assessment process slightly quicker, but take your time with learning that. Try one side at a time for now. I shall work my way around now. So now I'm following the iliac crests all the way around. Just bear in mind, like I say, it's almost like the arch on the top of Wembley Stadium, where it arcs round and down. So you've almost got two Wembley Stadiums, one on the left, one on the right. Follow it all the way around and down till you come to some very nice, clear, prominent parts that stick out at the back there, and that's your PSIS. Again, looking for how level they are. Don't assume that those both going to be in the same position. And in general, in some people, that's also where the little dimples lie. Okay, so then we can feel right side and left side PSIS. Okay, last one is the ischial tuberosity. Now, Neil, for the next part I need to feel is essentially in your buttock crease, just here, where we've got, essentially we'll go from buttock to thigh. So along that crease line there is where I need to feel the last bone. Okay, it's in the middle of your thigh here.
Yeah.
So to do that, I need to roll your shorts up. Are you happy with me doing that?
Yeah.
We roll our shorts right up here. We roll and tuck. Okay, so now we have the gluteal crease line here. We go mid-thigh onto the gluteal crease line, and then we push down until we can feel for the bone there. And it's always in the same position there, and that is our ischial tuberosity. Okay, tuberosity itself is quite big. It's almost like someone like that underneath there, sticking out. So we do need to feel all of it. So we can come medial, we can come lateral, and then just slightly rolling downwards, inferiorly and superiorly, all the way around. Obviously hamstrings originate here, so important one to feel. Okay, that's it. Hip assessment finished.